autism is not defined by the lack of skills, because we do know that there are many individuals on the spectrum that have gained wonderful skills, but they still struggle every day.
Welcome to Shared Steps, the RDI Journey. I'm Genevieve. Here we explore real conversations and meaningful insights about supporting neurodivergent children and families. Today, I'm speaking with Dr. Jade, a medical doctor and RDI consultant based in Malaysia. What I appreciate about Jade is her ability to bridge medical understanding and the relational heart of RDI. She brings a culturally grounded, thoughtful view of what families in our region are navigating. And she does this with such calm confidence. I'm excited for you to hear this. Hi Jade, thank you for joining us today.
Hi Jen, thanks for having me.
I wanted to find out, you are coming in wearing multiple hats. You come from a medical background where you were a pediatrician, and now you work as a RDI consultant, but you're also a parent. How does wearing so many hats shape what you do?
Just latching on upon what you said, I'm no longer in pediatrics. So yeah, I've left pediatrics like maybe a good 10 years. And I'm now a fully certified RDI consultant and also a parent to my child, who's currently 14 years old. Having the clinical knowledge is supposed to be advantageous in that sense, because when I came into the RDI program, we had to learn the basic development foundations, and there was a lot of neuroscience behind RDI. So having come from a medical background certainly helps in not just digesting all the information, but being able to actually see it firsthand and practice it on my son. I think that has been quite profound in shaping who I am really today. As a parent and also as an ex-clinician, I will say that even though with all the clinical knowledge, it still does not erase the profound emotional challenges that every parent face, including the initial shock of, like the diagnosis, the grief of the imagined future, what would be to your kid, the stress and the anxiety. It's still there, despite being a clinician, because at the very end of the day, you come back home, you're still a parent and you're still wondering, have I done the right thing? I could relate to the knowledge that's being imparted by RDI. I get it what they were trying to say, because from my background, I'm more like a scientific-based person. I like to understand and I like to read it firsthand rather than hear it from other people. So for me, the reading part helps me to believe, and then the practicing part helps me to grind things further. In that way, it helps me to shape me to who I am today.
And I think what you mentioned about grieving, that's so true, right? And it doesn't matter what your background is, your child is your child,
Yes. But having said that, Jen, I think as a parent and also as an ex-clinician, when we are breaking a news to a child, I learn to be more empathic. I learn to be more sensitive and to slow down further. And hopefully that makes me a better person, whether I'm practicing as a clinician or practicing as a RDI. The sensitivity that you yourself is a parent and you are talking to another parent, parent to parent, regardless of whatever background you may come from, you feel it even more, like as if it is the first time you are hearing the news yourself. Because I am, at the end of the day, in the same boat with them also.
And I think that helps as a consultant that guides families, because families feel like you can really connect with them and you understand where they're coming from.
Hopefully. Yeah.
So in the medical community, progress is often measured in terms of skills and milestones. How did RDI change that perspective, or for that matter, expand that perspective for you personally?
Maybe from a doctor perspective first, yes, you are right in saying that we use standard measurement scoring when a child first walk into the clinic. We have a set of questionnaires, and then we'll be scoring, and then we'll be testing and doing a set of developmental assessments with the child, right? And then we will tell the parents, okay, your child is now 8 years old, but he is at the speech level of 4 years old. When you talk in terms of developmental milestones measurement. When I came into RDI, it's not that all those measurements and scorings are not important, but RDI focuses more on not narrowing the developmental gaps. They are more focused on looking at the child as an individual. What is his strength? What is his weakness? Despite the diagnosis that a child may be getting. And then more importantly is not to chase after developmental milestones, because autism is not defined by, for example, what the child can do or cannot do, or it is not defined by the lack of skills, because we do know that there are many individuals on the spectrum that have gained wonderful skills, but they still struggle every day. So I think in terms of that, yes, challenge or rather broaden my perspective to look at autism differently. So in the RDI, what I learned, which I never learned in all my 5 years of medical school, I will say that, pouring through all the medical books and the ICD-10 coding, we were taught to look at things from symptom base. What you see with your eyes, what you pick up with your eyes, what you hear, what you listen, what you notice in the clinic. Every single symptom that the child would present, we were taught to pick up symptoms. But RDI expanded that view beyond symptoms, because it is not diagnosed by symptoms. It is diagnosed by what you don't see. What you see are just symptoms. What you don't see are core deficits. It was an eye-opener to me. When I first went into the program, then I was thinking, my goodness, it's actually core deficit. What the individual is lacking. For example, self-awareness, the ability to think flexibly. That is what is a deficit in them. Autism has been redefined for me by RDI, in short. And in that sense, because it is redefined differently, target approaches are also realigned, because how you define something is how you're going to treat it. If you're going to define it just by lack of eye contact, and then you are going to treat it by giving eye contact or teaching eye contact in a rote manner, but that doesn't address the core issues. So I find that definitions are very important, especially in the medical world. But there are a lot of things that we cannot change in terms of the medical diagnosis, and is based on the ICD international coding. But having said that, when I went into the program, the way RDI look into autism helps us to remediate it in a more meaningful way. And that makes a whole lot of difference to the functioning of the individual beyond the symptoms.
And I think that's what we've seen also in the kids that we support and the kids that we work with, that it really makes real change, like what you said, beyond just the symptoms or the behaviors that we see.
Yes, symptoms and behaviors. Now that you mention it, behaviors also, right? Because behavior is part of communication. For a child who has trouble expressing themselves, despite being very verbal, having a lot of language, they still will have trouble expressing themselves. And every behavior that is being picked up is actually a form of communication from the child. So that has taught me to, in a way, it also tells me that, okay, look beyond behaviors. Behavior is communication. So RDI lends that perspective. And I'm very grateful for that knowledge.
So what was it like for you to experience RDI, not just as a professional, but as a parent in your own home?
As a parent, I think I get to apply first-hand knowledge on my child.
Mm-hmm.
Basically, when we read about the core deficits, what the individual is actually lacking, and then when I look at my own son, I could actually relate to him in his day-to-day struggles, and that helps me a lot, the relational concepts. That helps me to see the why bother of doing a certain thing, of why bother of implementing a certain technique. Because I get to see it in my child, experience it firsthand, and seeing how he process things, slowing down, observing that, that has helped me greatly to actually fine tune what I learn in theory. Well, of course, we are still learning and we learn from mistakes. I'm grateful that I have this real life training every day with my own son. I mean, he's always readily available, and nowadays he just loves to hang out with us. There's no anxiety in front of him, the anxiety is behind him, and we have nice moments together. But yeah, I mean, that really helps me ground things as a parent to see things firsthand and also to appreciate the small changes firsthand. That itself is rewarding, it's gratifying, and it motivates you to try even harder. When I relate to my own experience as a parent, my first consultant that I looked for, well, it wasn't an RDI. I didn't go into RDI as my first intervention for my son, but I looked for a consultant who is also a parent. And I think for reasons that are obvious, maybe I feel that I can relate to that parent, or rather, I hope the parent can relate to my own struggles. As a professional that's also practicing RDI as a parent, but I think that a lot of times when we sit down together, it's more like a support group rather than I know more than you and you are my family and I'm the consultant. So we are all coming into the same learning, and I'm learning from you and you are learning from me as well. I have the experience as a parent that I can bring it to my professional work. I think that has greatly helped me gain the trust of the families, especially in the initial stage where things can be uncertain or unsure.
You have twins,
Yeah,
right? And a lot of families come with more than one child.
that's right.
So how do you use your experience in terms of, or what was your experience balancing out between both so that one does not feel like, oh, mommy only bothers about, my brother and not about me. How do you go about balancing that out? And then how do you use your experience helping families that have multiple kids?
I have to admit, I'm not good at balancing out. I was too focused on, one child.
Mm,
Yeah. But I'm trying to change that. I think part of me is still going through that change, still learning. I think what I can say is I've been fortunate in my own experience with regards to having twins. The other twin is very, very understanding and very, very compromising. And I've been fortunate in that sense. But I can't say it would be the same experience for um, other families with multiple children. Because a lot of times, what I see is sibling rivalry. They will fight for the parents' attention, and that is very normal. And from the parents' perspective, right, of course, when you have a child who's diagnosed on a spectrum, and then all sorts of things follow through. My child needs me more, that kind of mentality, right? My child needs me more. My child needs my attention more. My child needs more of my time and my resources. A lot of times things are not perfect, Jen. I do see an imbalance. I do see siblings getting left out. They even want to be in the video. They want to be recorded.
yes, that's true.
Why am I not being, in this recording? I wouldn't say that I'm the perfect example, but I would tell the parents that, look here, I've made some mistake. Like you, I've been focused on one child too much. So learn, learn from my mistakes. I'm still learning from them. Try to have a life outside of autism also. So as a professional, a lot of times, a lot of the focus whenever we turn on the meeting for Zoom, a lot of times we'll be asking about the child. So I make it a point to ask about how's the family as a whole. What is the brother doing? What's the sister doing? Hopefully, we create a balance from there. We try and remind ourselves that every single individual in our lives, in our family, is equally as important and as deserving.
Yes, balancing can always be very challenging.
Very challenging. I don't know about you, Jen, but yeah. Yeah, I always admire those with multiple kids. I think even two, it's still manageable, but I've got families who have like eight. Very
Wow.
big, yes. And
That's hard.
yeah, and out of the eight, like a set of twins will be affected with
Mm,
autism.
mm,
But the beauty is that because it is a relationship-based intervention,
mm.
everybody comes in. The elder brother comes in and becomes like a guide to the younger child.
Yeah,
And
yeah.
that is really beautiful. And
Mm.
that is what we want.
What role do you see RDI playing, in particular in Southeast Asia, as awareness starts to grow?
Positive, mostly, I think. I
Mm,
see RDI gaining traction, gaining momentum. I think families are getting more aware of the limitations of just skill-based interventions.
mm,
They're getting more educated in that sense, and they're looking out of their scope, looking out of their boundaries for alternatives, and they're looking for a relationship-based parent-led interventions. And I think it's positive note in that sense if parents are starting to change their mindset and looking beyond what else is there apart from traditional interventions. I'm not saying traditional interventions are bad, but yeah, what else is there for kids to have that further cognitive and developmental growth? What else can we contribute as a parent apart from just sending our kids to therapies? What can we do at home? I do see parents asking that more frequently. They want to do their part, but they just don't know how sometimes. Of course, the doctors will tell them when they go for visits, but there need to be something more grounded, more consistent in the sense that it lends a more consistent support and guidance to the parents on a more consistent basis because they may see a doctor, but the interval would be like 3 to 6 months down the line. But
yeah.
what happens in between? They are still living with the child under the same roof. So, in that sense, I think RDI has a role to play because of the very detailed supervision parent led model. I think for the professionals, I have to admit, I think most professionals have not heard of RDI,
True, that's true.
relationship. Yeah. So not just doctors, but I think word is getting out to professionals, not just doctors, parents, therapists, teachers, educators for that matter. More and more are getting aware, and I'm hopeful. I think I'm hopeful in a sense that RDI will transcend to being, don't know if I'm too ambitious to say this, maybe in line with more therapies that are more mainstream, especially for Southeast Asia, where I think culturally we are more family based also.
Mm-hmm.
We are deeply rooted in our, how do you say, family values. And I think it will gel. I think the concepts of RDR will gel to, in that sense, to a lot more people. And hopefully it reaches out.
So, what do you hope that parents and professionals can take away from this conversation that we're having today?
For the professional, one of the things that can be emphasized is looking beyond symptoms, looking beyond milestones, looking beyond skills, but look at the child. Listen to what the parents want. Sometimes I think there is a discrepancy between what the parent wants and what the professional can give. Push that all aside and start to listen because a lot of times we are confused. There's a myriad of information out there and parents can get lost. So look beyond the symptoms, of just treating symptoms or extinguishing behaviors, but instead look at the child from a developmental point of view, what the child actually needs, and then cater towards that. Simplify the advice given to the parents, because sometimes parents may go back home, they will try whatever strategy you are telling them, but they may get lost and confused, and that adds up to the stress. I know it's not easy because as a professional, I've worked in a clinic before, and because we have 50 patients waiting outside, we cannot just simply slow down for, everybody. But try. Despite the time constraint, look beyond skill-based models or intervention, because treating autism is not just about giving skills. Treating autism is about rebuilding the connection back. That is what is missing. I'm also hoping that they could broaden their perspective to explore developmental-based therapies, family-based therapies that look beyond the symptoms and actually address the core deficits. For the parents, I think a shift in the mindset. That's what we want. I think for the parents, and I would say for the parents and the professional, like the same thing, we want a shift in the mindset. A shift in the mindset from just symptom-based to what the child needs developmentally. What is the child's strength? What is the child's obstacles? And a shift in the mindset in terms of the types of intervention that are available. Is it just surface skill level? Are we just addressing skills? Or are we going deeper? We need to have that shift of the mindset. The other shift of the mindset that I can think of is, I think as a parent myself, we always think that someone else is better to do the job than us. And I hope that with more parent-led interventions like RDI, parents and professionals can shift the perception that can be the primary agent for change and empowerment. You don't need to be an expert in autism to be with your child, because as parents, you are the expert of your child. You can have the empowerment through parent-led based intervention, through the support, through the supervision, through the guidance, and we can return back the sense of empowerment for parents to be the primary agents of change that make a significant growth in the child's cognitive growth and life. I think a lot of times that empowerment was taken away when the child is diagnosed with autism, and a lot of times parents feel helpless. Doesn't mean that they are the sole agent for guidance, but they can guide their child.
And I think you made such a good point, about parents being the experts of their own child, and how it's so important to give parents that confidence and to empower them to feel that they can be the guides to their child.
Yes, the confidence. Yeah. The confidence has to be returned to them, because that empowerment is very, very important for them. Especially parents who come from a long strand of therapies and they have been dependent. They create a dependency to the extent that they don't know their identity. They lose their identity as parents, their parental rights, And this is the most primitive, I would say the most intuitive form of guiding starts from, from the parents themselves. We are not textbook people. Nobody tells us a manual. I mean, Jen, you're a parent yourself, right? Do you read a textbook to know how to be a parent? These are intuitive in us. That intuitive feeling somehow has gotten lost in the chase for interventions, I feel. And there has to be a shift of mindset.
So if someone is listening today and they want to take just one step, what would you recommend?
One step only?
So if they just wanted to start and try just one thing, what would be the one thing you would suggest?
Call one of us. No. I think it's just to connect with your child. I think just pick out a small moment of your day, put everything aside, and just look at your child, watch him or her, put aside any agenda that you may have, that you may want to teach him or her. And why I say this is because I feel it as a parent also. I used to feel that whenever I sit with my own son, I have to do something with him.
That's the pressure a lot of parents feel, right?
Yes. It's like, I just like, what's my goal with him? What objective do I have? What task do I plan for him? We are a very task-focused people. And I'm not sure about, and I mean, maybe it's from how I was being taught in my childhood, my upbringing, but I want to move away from that. And I want parents to actually be able to move away from that. So if they can do that one small step, but that very meaningful step is just to watch them and to connect with them and to just focus on the child and not have anything, any specified agenda. It may sound easy, but it is very hard to do. Trust me. Try it and tell me what you notice in your child's expression. You may notice things that you don't notice before. For example, how is he processing something? How is he taking in a sensory sensation? And when you start noticing all these small little things, it's going to help you greatly in your guiding. And that's how we slowly become what RDI teaches us is a mindful guiding.
And that's such great advice because very often we're all rushing here, rushing there.
Yes, in with
We
my
don't.
child, I'm with the handphone.
Yes,
With
there's
my
that
child, and
too.
I'm checking my handphone to see my work, or that. So we are
Mm,
not fully present all the time, and
mm.
then we blame our child for being distracted. When we ourselves are not present in the moment. It is a challenge in this day and age with the technology that we have also, but it can be done.
Thank you, Jade, so much for joining us. I really appreciate your time and your insights.
No problem, Jen. Thanks for having me, and I'm happy to share as well.
Thank you for joining me on this episode of Shared Steps, the RDI Journey. If you found today's conversation meaningful, I'd love for you to follow or subscribe so you won't miss the next episode. And if you know a parent or professional who might benefit from understanding RDI a little deeper, please share this podcast with them. Every small step helps us spread awareness across Southeast Asia and beyond. Thanks for listening, and I look forward to having you with me in the next episode.